Hi, everyone. Thank you for being here, both in person and online. My name is Maddy Palmer. I use she, her pronouns. And yeah, today I'll be sharing some reflections from my practicum with the First Nations Health Authority, as well as some key insights, exploring how cultural safety is embedded in health governance spaces, and how it's a key contributor to First Nations self-determination and overall wellness. So I'd like to begin by acknowledging the lands that I'm presenting from today. So we are currently residing on the traditional unceded territories of the Lekwungen peoples, of the Salnhees, Kosapsum, Esquimalt nations, and also of the Wasanich peoples, who also have relationships to these lands. And I'd also like to acknowledge the traditional territory of the Ligodo people of the Wiwaikai, Waiwaikam, and Quexa First Nations. That is where I live, up in Campbell River, and where most of my practicum learning took place. And with that, I'd also like to take a moment to reflect on my own positionality within this work. I am Red River Métis from the Janai and Morrisseau families, and I also carry Scottish and Irish ancestry. And while I am Indigenous, I am not a member of a First Nation in BC. And as that goes, I'm a guest on these territories and a guest to this work. So I'd like to acknowledge that my presentation is not speaking for FNHA or for any of the First Nations communities they work with and serve, but rather it's just a reflection of my observations and learnings from their work. So a bit of background. So FNHA is the first province-wide First Nations Health Authority in Canada, which represents a pretty unique and significant shift towards First Nations self-determination in the healthcare field. FNHA works with and supports over 200 First Nations in BC. And on Vancouver Island specifically, this includes the 50 First Nations within the Coast Salish, Nishalnoth, and Kwakwakiwak cultural families. Each of those holding distinct histories to the land, governance patterns and systems, and relationships with land and health. I had the opportunity to join the Cultural Safety and Humility team in the Vancouver Island region with FNHA, and I am very grateful for that experience. This team works both upstream and downstream, supporting individuals who have experienced harm while also working to prevent future harm in healthcare. This includes upholding First Nations decision-making processes, supporting respectful and reciprocal engagement, and strengthening accountability within health systems and health partnerships. Now, before I dive deeper into what I was up to and what I've learned, I wanted to briefly ground us in two kind of concepts. So first, cultural safety, and second is cultural humility. These concepts are really central to my work. Cultural safety is an outcome of respectful engagement that addresses power imbalances in healthcare, creating environments free from racism and discrimination where people feel safe receiving care. And cultural humility is an ongoing process of self-reflection to understand personal and systemic biases, grounded in respectful relationships, mutual trust, and lifelong learning. I find these are really important definitions to share because they really do shape how I approach my learning and how this work is approached as a whole. So with that grounding, my role as a student was really focused on both observation and engagement in my role. I spent a lot of time reviewing policies and frameworks and offering feedback through a cultural safety lens. I also participated in some planning and governance discussions with FNHA, joined several communities of practice across the organization, specifically in cultural safety and quality care teams, which was really great because it allowed me to collaborate with teams in other regions as well. I attended a number of FNHA and external webinars where I got to deepen my knowledge on cultural safety and Indigenous wellness. And I also got to do an Indigenous cultural safety training program through the Sanyas. A large part of my practicum did involve connecting kind of what I was observing in practice to greater public health concepts. And I really tried to deepen my own learning through reflection. So I did a weekly reflective journal, an excerpt I've shared here. And I often had lots of debriefs and meaningful conversations with my wonderful supervisor, Krista Joseph, and other FNHA colleagues. This work is kind of inherently relational, and so a lot of my work was based around relationships and learning through discussion. So drawing on my practicum experience, my culminating paper really focused on kind of a greater central question, and that is how is cultural safety embedded in practice within a large colonial health system? I explored how it takes shape through First Nations governance and self-determination, policy and language, and accountability processes. Prior to my practicum, I largely understood cultural safety as an education-based opportunity as far as the work goes, and often in the forms of workshops aimed at individual awareness. But through my experience, I really came to understand that the work happens at a much broader level and really aims to tackle systemic and structural change. So I'll spend the next few minutes kind of going over a couple of key takeaways from my learning. So my first takeaway is that the work in policy uses language not as neutrality, but that it is actively used to shape power, outline priorities, and influence how knowledge is translated. For example, in reviewing and providing feedback on key documents, such as the new FNHA Vancouver Island Regional Health and Wellness Plan, which will be released probably later this year, discussions within the team and with my supervisor often focused on how language could either strengthen or dilute First Nations autonomy, particularly in how decision-making processes were upheld in First Nations communities, and whether the wording used in policies clearly centered First Nations communities rather than positioning them as consultants. This highlighted that cultural safety extends beyond like one-to-one interpersonal interactions, and goes deeper into commitments and underlying values that are embedded in the policies that guide the work. My second key finding was that accountability must be relational. So FNHA uses the term reciprocal accountability. We often hear relational accountability, but they use reciprocal accountability as a reflection that responsibility sits within relationships and where everyone involved is expected to uphold their role in supporting community well-being. An example is FNHA's complaints pathway, which is not only about documenting incidents of Indigenous-specific racism, but it's about listening to and supporting individuals, raising concerns with health partners, and identifying those broader systemic issues that need to be tackled. This approach was closely aligned with the In Plain Sight report, a 2020 provincial report that identified high prevalence of Indigenous-specific discrimination and racism in BC health systems. Its recommendations call for accessible, culturally safe, and trust-based accountability pathways, and it's a key guiding document that guides FNHA's work in this space. Lastly, First Nations governance also emerged for me as a key contributor to community wellness. Governance spaces aren't just administrative, they're where values and accountability show up in practice, through who makes the decisions, how decisions are made, and how relationships are built and maintained in a good way. Throughout my practicum, I saw how FNHA upholds nation-based governance structures by guiding health partners to the appropriate engagement pathways and respecting First Nations decision-making. By doing this, FNHA actively helps reduce duplication and engagement burden on those communities, and in this way, governance itself becomes a tangible expression of cultural safety, which is enacted through those relationships and shared accountability. So to kind of summarize my learning a bit and kind of the greater vision I saw through my learning experience is that cultural safety and humility aren't things that you can just workshop or cross off on a checklist. They're ongoing practices that go beyond individual intention, and they're reflected in greater decision-making processes, relationships, and accountability mechanisms. And in that sense, governance and nation-based decision-making are public health interventions in themselves. It's important to remember who holds the power and how that power is exercised directly shapes First Nations community well-being. And ultimately, advancing health equity means supporting First Nations self-determination within the healthcare system. I really hope to continue to carry these teachings forward in my public health career, especially when working in systems that weren't originally designed with the Indigenous cultural safety or humility in mind. And before I wrap up, I did want to take a moment to share my gratitude to many folks. First to FNHA as a whole, I think it's really amazing that they have this centering of cultural safety and First Nations self-determination in everything that they do. To the Vancouver Island CSH team, the mentorship, guidance, and openness really made my learning experience super meaningful. And a special thank you to my supervisor, Krista Joseph. Your wisdom and guidance and endless encouragement really made this the best experience. And you were also just lovely to get to know as a person, so thank you for everything. And lastly, to the local communities and nations who share their lived experiences and their immense knowledge in order to educate and create change. I'm really grateful to learn from all of you. And lastly, a thank you to Jeff, all of my professors, and also all of my peers. You all are amazing, and I'm so happy to be here with you all today.